prescription today, okay?
Okay,
Do
good.
you have a couple minutes with me?
I do have, yes, thank you.
And I do see here that you here for the Novolog vial injection?
Yes,
the
I am.
insulin?
Yes, yeah, I do, but I have a question though. I have a question about the injection.
Okay.
I know my uncle who was diagnosed with diabetic for almost a couple of years, and he uses this injection, and he has some lump on his thigh where he uses the injection. I don't know, I'm afraid, I'm just 21 and I'm just diagnosed. I'm afraid I may have similar lumps. Is there any way I can avoid that?
Yeah, that's actually a really common, it's kind of, you can call it a side effect when a patient keeps injecting at the same site over and over times. That's when it happens. There's many ways that you can avoid that, and one of the easiest ways, you can just rotate the injection site. You can just inject in your arm, your buttock, your thighs, or your abdomen. You can just rotate, and you can just inject 1 inch apart every time you do that. So I can go over that later on in depth with you later. But definitely we're gonna have some way to manage that.
Because my uncle, he always found doing it at 6 hours. Probably that was why he was having.
Yeah.
I have a friend of mine too who's diabetic as well, but he's taking pills. But why? I don't know why I shouldn't take pills. Pills are even better for me. Why shouldn't I take the pill instead of having to take injection?
Okay. You are diagnosed with diabetes type 1. So for diabetes, actually 2 types, type 1 and type 2. For like your friend's situation, when they take pills such as other oral medication, that's mostly for type 2 diabetes. For type 1 diabetes, for now, the only available treatment that we have is injectable insulin.
Oh,
Since your body is not producing enough insulin, so that's the only way that you're gonna get insulin to your body.
I don't know why my doctor mentioned that to me though, but yeah,
No
thank
problem.
you for that information. Yeah.
Okay. So right now I want to go give you some more information about the medication. Okay. First, for this medication, you're gonna inject 10 units 3 times a day, subcutaneously before meals. So technically, subcutaneously means that it's just right under the
Before meal,
skin.
like how long?
Before meal, like 3 times a day, like before each meal, like breakfast, lunch, and dinner.
At the time before meal?
15 minutes before
Oh, okay.
meal. Okay, and the next, another thing is, like I said, mentioned earlier, it's just right under the skin. Okay? Right under the skin before you go into the muscle. And I'm going to show you how to properly administer the medication later. Okay? And if you notice that the medication is cloudy when you open it, it has some particle in it, then just don't use it. And it always has to be clear. Okay? So the next thing I want to talk to you about is there's several sites of administration for your insulin. So first of all, it's your abdomen, also your arms, your thigh, and your buttocks. But what the best site for absorption would be your abdomen. And to go back to your concern a little earlier that you mentioned that your uncle have these lumps at the site of the injection. Over time, like I mentioned earlier, it's because they keep injecting them over and over again. So to avoid that, we wanted to rotate the injection site. So you can inject in the arms, and then the next time you inject it, you can do it in the abdomen and then the thigh. But let's say if you decide to just use your abdomen to inject insulin, since it's the best site of absorptions, then you can just do it 1 inch apart each time you administer it.
And how do I inject it?
Oh, and I'm going to walk you through it, how to inject it using the vial and the syringe later.
Okay.
So yeah, we can go back to later, and I'm going to show you how to properly dispose them as well. Okay?
Yeah.
So the next thing I want to talk about is storage for this medication. Like you noticed earlier when you receive it, it's cold and it has the label saying refrigerated. So for insulin, if you're not going to use it right away, it should be stored in the fridge, but not in the freezer. Okay, just do not freeze it. And also, but after you open the vial, it can be stored in a room temperature for another 28 days. Okay, and you want to keep it in just a cool, dry area, avoid from direct sunlight and heat. Like, for example, not in your bathroom where there's a lot of moisture, not in your garage, not in your car.
Okay, because I was to ask, because I go to work, and I was able to think I can keep it to my car while I'm at work.
Yeah, you should just keep it with you, and then let's say if you're gonna go to your office, and you can bring it with you, or in the meantime you can, if you have your certain cabinet that you can put in at your office area, yeah, that should be great. Okay? Yeah, because in the car temperature might go up, and we don't want the insulin to go spoil. Okay? 'Cause it's taking like a protein. Just think about like a soup broth.
Yeah.
You know, when it's the heat go up, it can make it get spoiled.
Yeah,
Just something like
exactly.
that. Okay? And also, you want to also keep it out of reach of, if you have any family member, any children and stuff. So just keep it proper label and then keep it away from children. Okay?
Okay.
And also, there's some common side effects that are associated with this medication. The first thing is this is an injection, so you might notice a little irritation to the area at the site of injection, such as pain, redness, little irritation. But it also should go away after a while. But if you notice that the pain is, it's really severe pain, it's really red, like it looked like more of a serious allergic reaction. So this is the first time using this medication
Yes.
as well. So you should be look out for those signs and symptoms. And when those happen, just stop using it right away and give us a call, give your doctors a call.
Okay.
Okay? Other than that, you might experience little headache, little dizziness, and little blurry visions, a little drowsiness, and could be a little rapid breathing as well. And however, these are just common side effects. Even though they're common, just still let us know so we know how you're doing with the medication as well.
Okay.
There's other serious side effects that I do want you to look out for. Okay, so this is a medication to lower your blood sugars. Essentially, so they're in fact going to be lower your blood sugar. That's one of the reasons why we ask you to inject 15 minutes before meals. Okay, because we don't want your blood sugar to drop so low. That's gonna lead to some signs. You're gonna be noticed like a little tingling, burning, a little tired, weakness in the arms. So when those symptoms happen, even though it's just a beginning stage, you always want to keep like some candy with you. So when you notice those signs, just take candy right away to help bring up your blood sugar back.
Okay.
Okay? Because those, even though low blood sugar doesn't seem like it's gonna be bad, but actually can lead to serious complications. Okay? Can cause certain brain damage and sometimes seizure. It can make you pass out, and sometimes it can lead to death as well. Okay? So you want to definitely take a note on that. Okay?
Yeah.
Also, low potassium blood level can also happen. Okay? So you want and again, if it's just little low, you wouldn't notice anything. So that's one of the reasons you should have your lab checked regularly. Because if it persists and it gets severe, it can lead to, a lot of cardiovascular, abnormal heartbeat, and like very bad breathing problems. So we want to avoid that.
Yeah.
Okay. All right. So also, since it's the first time you're taking this medication, I want to see how you do on this medication, what effect it's gonna have. So just avoid driving or doing any tasks that require your attention. Okay, especially right after you inject the medication. Just let's say you're gonna go home and try out today. Just stay home, get some rest. See how you react to the medication first.
Okay.
Okay. All right, and let's see. And for these medications, it's pretty. There's many studies have been done, and it's pretty effective for diabetes type 1. It has been compared to a lot of other insulins. So the main point for this medication is you have to use it as directed and continue to use it regularly. And later on I'm going to show you how. You just can use it at the right time, the right way, and you should be good.
Is it for all my lifetime? Or?
Yes, for this, unfortunately, because like I mentioned earlier, your body wasn't able to produce insulin. Okay, so you need to have some sort of external insulin, kind of like, if you want to put it like that.
Okay.
Okay. You might want to also limit your alcohol intake while taking this medication, because it can increase the risk of developing low blood sugars, and those are the symptoms I mentioned earlier. And also, in order for you to get the best out of this medication in terms of safety and efficacy, it's very important for you to take this medication regularly and as directed per your doctors. Besides that, diet and exercise gonna play a huge role in terms of controlling your blood sugars. And so for exercise, really simple. You can just do 30 minutes a day and do it about 5 times a week. For diet, there's many diet plans out there that you can try, but mainly most of them are just have to have high fiber intake, high protein, and lower your carbs. Okay, if you want, we can go over a little more in depth in certain plan that you might be interested in. Okay. Also, it's also important to have your lab check and your blood check regularly. So you should check your blood glucose using the test kit at home that you have already received. Just do that regularly as directed by your doctor. But you also should follow up with your primary care physicians. You should schedule regular eye exams as well as to test for your kidney function. So these are to prevent any kidney damage in the long term, blindness, nerve problems, or other serious complications. Okay? And it's another important thing is you should get your flu shot, flu vaccination every year, okay? Because it can create a serious complication when you are diabetic. Okay? Now I'm gonna talk about. Now I'm gonna show you how to use this syringe and vial to inject your NovoLog insulin. Okay? So right here, as you might have seen, there's unit on the side, and for your prescription, you're gonna be using 10 unit, which is right here. So the first thing you want to do, you want to draw air to that right at that line. Okay. You're gonna inject this into the vial and invert the vial, and then you're gonna inject the air into that vial. Okay. And then after that, you can draw back about 12 unit. Okay. All right. You might need 12 units just because so you can get those the extra air bubble out. As long as you get the exact 10 unit, you should be good. Okay. All right. And the way you want to inject it is, let's say you're gonna inject. So I'm gonna show you right here, but you can use the arm, the thigh, or the abdomen. It's depend on you. Okay. So the way you're gonna pinch the area like this. Okay, you can just pinch the area and you're gonna inject it at a 90 degrees angle. Okay. All right. So before that, you should use alcohol swab. Okay, wipe it 3 times, clean the area well, and then just like I said, just pinch the area and inject it. Also, wash your hand before and after each injection. Okay. All right. Any other questions?
No, I think I got it. How to use it. But thank you so much for walking me through this.
All right. And one last thing is, after you're done with your syringe, you should also grab one of the sharp disposal on your way out, so you can just dispose this after use. And when this is full, just give us a call. I'll give your doctor a call, and we're gonna show you how to properly dispose of that. Okay. Okay.
Thank you.
Okay. Thank you.
Yes, ma'am.